Hello friends, a warm welcome to you from SGT University. I am Dheeraj Sharma from SGT College of Pharmacy. Today in this video, we will be learning about general mechanisms of drug action and various factors that modify drug action. The steps and path followed by drug to produce its pharmacological action is called mechanism of action. This involves how, where and when. A mechanism of action usually includes mention of the specific molecular target to which the drug binds, such as an enzyme, receptor, ion channel, transporter. Some drugs resemble the natural substrates, bind enzymes, and cause change in their activity. In therapeutics, drugs causing inhibition of enzymes are generally used. This combination of drugs with the enzyme may be competitive or non-competitive. Before understanding these inhibitions, let's understand normal enzyme catalytic cycle. During the normal enzyme catalytic cycle, the substrate encounters an enzyme with a specific active site to which it binds, forming enzyme substrate complex. The enzyme then facilitates the breakdown of the substrate to products which part from the enzyme, leaving the active site free to catalyze another substrate as the cycle begins again. Now let's see competitive inhibition. Competitive inhibition occurs when an enzyme encounters a blocker which mimics the properties of the substrate and binds to the enzyme's active site. Thus, when the substrate is encountered, the active site is not available for attachment and no reaction will occur. Examples: angiotensin converting enzyme inhibition. Non-competitive enzyme inhibition involves the binding of a blocker to the enzyme away from the active site. This binding causes a conformational change in the enzyme, altering the shape of the active site, which prevents the substrate from binding and showing action. Example: omeprazole inhibits hydrogen potassium ATPase. Some drugs bind with receptors. Receptors are macromolecules involved in chemical signaling between and within cells. They may be located on the cell surface membrane or within the cytoplasm. Molecules like drugs, hormones, neurotransmitters that bind to a receptor are called ligands. A ligand may activate or inactivate a receptor. Activation may increase or decrease a particular cell function. Another possible way of drug action is modulating ion channels. Ligand-gated ion channels are susceptible to modulation by many clinically useful classes of drugs. Like in case of sodium channel blocker in nerves, when sodium ion enters through sodium ion channel, it transmits the electric signal. With sodium entering through sodium channels, the electric signal is transmitted throughout the nervous system to its destination. When sodium channel blockers bind to the sodium channel, they close it and keep sodium entering the nerve with less of the positively charged ion entering. The electrical signal is stopped with sodium unable to enter. The electrical signal is stopped at local site. Pharmacodynamic studies have reported that several drugs work through membrane transporters. Let's see an example. Selective serotonin reuptake inhibitors work by inhibiting a mechanism called reuptake. In reuptake, a protein called a transporter transports excess neurotransmitter molecules out of synaptic cleft, usually back into the neuron that released them. SSRIs inhibit the reuptake of serotonin by inhibiting the removal of serotonin from synaptic cleft. This causes levels of serotonin in the synaptic cleft to rise, which may help in treating symptoms of depression. Some drugs act by virtue of their simple physical or chemical property. Examples are bulk laxatives like isabgol, which act by using its physical mass. Second example, para-amino benzoic acid, which uses its property of absorption of UV rays. Antacids, which use its property of neutralization of gastric hydrochloric acid. Radioactive iodine and other radioisotopes use their property of radioactivity. Activated charcoal is used for its property of adsorption. Factors modifying drug action. Physiological factors. These are age, surface area, body fat, pregnancy, plasma protein binding, drug dependence. As you saw, age, surface area, pregnancy affect drug action. I would like to tell a reason. It is so because with age, surface area, pregnancy, volume of distribution and number of receptors and other macromolecules vary. Let's have a look on pathological factors that can influence drug action. Pathological factors: liver disease, renal disease, malnutrition. C. Liver is an important site of metabolism, so its condition matters a lot for drug efficacy and duration of action. Let's know about other factors. Genetic factors. It may be at level of receptors or at level of enzymes. Idiosyncrasy. It is the abnormal drug reaction due to genetic disorder. Other factors are like route of administration, time of drug administration, preparation and form of drug, interaction between drugs like synergism and antagonism, or interaction of food with drug. So today we have covered general mechanisms of drug action and various factors that modify drug action. Next time we meet, we will be learning about general anesthetics and various adjuvants. Till then, keep learning, keep growing. See you next time.